Welcome to today's webinar on Provider Connect Australia. I would like to start by acknowledging the traditional custodians on the land on which we meet today and pay my respects to the elders past, present and future. I recognise and respect their unique cultural and spiritual relationships to the land, waters and seas which continue to be important to Aboriginal and Torres Strait Islander people living today. I extend my respect to the Aboriginal and Torres Strait Islander people who are present. Please note that everyone will be on mute throughout the presentation to cancel out any background noise, and we are recording the session so that people can have access to it later. During the presentation, if you have any questions, please feel free to put them in the chat pane, and if time permitting, we'll answer them at the end of the webinar. And if we can't, we'll send out the answers in coming days. Just want to acknowledge that next week we have another webinar on the 11th of June for My Health Record for healthcare providers. Today we'll be learning about Provider Connect Australia, introduction and how to register. And presenting this webinar from the Digital Health Agency, we have Jay Weedle, Acting Project Manager for Allied Health and Digital Adoption, the National Program Delivery Branch. Over to you, Jay.
Awesome. Thank you so much, Vanessa. I'm not sure if you did see the chat, Vanessa, but I actually delivered a webinar to ACRRM last week, and I believe that Marilyn was in attendance there. Okay. So I think we've only got one attendee, which is absolutely no problem. Hello, Melanie. I hope you can hear me. Given I suppose given Melanie that we've just got yourself, please feel free to come off mute if you want to. If you need to interrupt me at any point, absolutely no problem. I'll run through the content and then we'll kind of throw to questions from there. Okay, so Provider Connect Australia. First of all, what is it? So it's an initiative of the Australian Digital Health Agency, commonly referred to as PCA. The idea of Provider Connect Australia is to connect providers with their business partners. Now, in the context of PCA, a business partner is anybody that it basically assists you with your healthcare service delivery. So we're talking about things off to the side that aren't directly practices. So things like Medicare, the National Health Services Directory, your PHN, your private health insurers. So people like that, they're not directly providing a service to patients. However, they're there to assist you with delivering that service. The idea behind PCA is that it streamlines registration and ongoing updates and enables healthcare providers to maintain a single source of truth of those details. So the idea behind Provider Connect Australia is to support that digital health interoperability. And in the recently released National Digital Health Strategy, PCA was actually mentioned as one of those key change enablers. So from the government's perspective, PCA is one of those things that's here to stay and intends to grow, hopefully substantially, in the next couple of years. So as I kind of touched on in the first slide, the challenges for healthcare providers. So as a healthcare providing organisation, anecdotally, we've heard that if a new provider were to join a practice, you can be informing up to 14, 15 different organisations of the fact that that provider has joined the practice. And with that, you're kind of repeating the same details over and over to those organisations. So things like the NHSD, online booking systems, funders, your primary health networks, communication services, diagnostic services, hospitals, and then those peak associations and peak bodies. So the PCA rollout, it came about as I suppose did a lot of advancements. It came about in the COVID times, and it was originally created as something called CVIT, which was the Clinical Vaccine Finder, which basically allowed a consumer or a patient to find a vaccine provider in their local area. And from that, it's kind of morphed into what has since become PCA. So being such a new product, it was officially rolled out to everybody mid last year. So in August, September last year, we started that actual rollout. And from here, we've been focusing on particularly allied health, as we've already had a lot of general practices register. So how it works. You can see up here on the left-hand side, we've got our healthcare provider organisations. So your primary care, allied health, pharmacy, specialists, hospitals, jurisdictions. What What they do is they would register for PCA, they would input their organizational details. So we're talking things like the practice names, service types, contact details, the practitioners that work there. Information that largely sits in that public stratosphere. So people are aware of the information, or you're able to obtain it via other means. But often, you're visiting several different websites to obtain that information. The idea here is to collate that information into one space that's then able to be shared on. So that information's fed into PCA by the practice. From there, PCA does a couple of validations. So it validates the ABN against the ABR data, both public and private. It also verifies whether or not the organisation has a HPIO, and then whether the practitioners themselves have HPIIs. It does that through connecting to the HI service, through Medicare, and then also the AHPRA data feed. Once that information has been verified by PCA, you're then able to update your business details. So that essentially the things along here on the left-hand side, so there's service delivery details, but you're also able to update details around hours that the practice is open for, days that particular practitioners work, the types of services that you provide, even banking details. And from there, you're able to feed that information off to your various business partners. So we've got a couple there on the right-hand side. One of the big ones that a lot of providers are finding value from currently is feeding data straight into the NHSD and then having that information appear on Health Direct. So both the provider directory and the public consumer directory, where you're able to look up services in your area and then access those services. So the main benefits for healthcare providers is reducing that duplication with a long-term goal of having less forms to complete and knowing that all business partners receive information at the exact same time. By saving that time, it reduces the amount of following up and redirecting of messages or information that's been shared in error. Streamlining processes. So in a very recent PCA release that's just happened on the 28th of May, there's been functionality built in that allows the automatic pre-filling of business partner forms. So there's a special integration that the business partner would need to do on their end that would essentially allow any forms that they have to pre-populate with that information from PCA. So, names, addresses, contact numbers, etc. So can save time there. There's obviously we use Medicare as an example. Medicare has their banking details forms. The long-term goal would be that despite legislation being in place that requires those forms to be signed, we could at least pre-populate that information that would then allow you to hand that to the GP to sign, and you'd be able to ship that off to Medicare. And then improved awareness. So the idea being that if you're updating things once in PCA, your business partners are made aware of it that day when you make the update. It doesn't rely on sending multiple emails or sending out multiple forms. The main benefits for our business partners. So what the value add for them is the timely notifications when healthcare providers do change their details, the reduction in data entry errors, and business partners knowing that they're receiving validated and complete information. There's another handy feature that's just been added in PCA is that if a business partner notices that some information is perhaps incorrect, so for whatever reason they identify that, okay, this is a practice that's in New South Wales, why have they given us a Queensland area code phone number? The business partner can actually query that information and request that the healthcare provider review it. From there, if the healthcare provider makes a change, that information then flows back out to all the business partners. So that great way of assisting with that interoperability and making sure that everybody's got the correct data at all times. This is less important for a healthcare provider, but it is important to know. So as a business partner, there's quite a few different integration options. So the simplest and most basic form is email notifications of changes. So that would mean if a business partner had a healthcare provider that was sending them information and the healthcare provider made a change, the business partner would receive a simple email saying, hey, please log into the PCA portal. There's an update that you need to view. There's also the option to download data as a delimited text file. So that means that the business partner could log into the PCA portal at any time and download essentially a data file that they would be able to upload into their systems. The most advanced is the integration with the PCA API. which is where we start to get this really, really fancy stuff happening. So that's that pre-population of forms. The NHSD, so the National Health Services Directory, they actually use the PCA API, and that's why when a provider makes a change on their end and it flows through to the NHSD, it will appear on the Health Direct website in a matter of hours. So if for whatever reason a practice made a decision that they were going to open on a public holiday, for example, and they wanted to make sure that their patients were aware of that, they could update it within PCA. That would flow through to Health Direct, and then that would show from essentially a couple of hours. So for further information and support about PCA, given that this is such a new product for the agency and something that the agency is really, really heavily invested in, they've created a new team called the Digital Adoption Support Team, which is a team that is able to assist providers and healthcare organizations with registering for PCA over the phone if they feel like they want assistance, so basically stepping through the steps. So it is an online portal. It's easy to register, and I will demonstrate that shortly. However, there are a team that are able to assist, and I might just verbally read that number out. So it's 02 6223 0741, 02 6223 0741. Now, they're not your traditional help desk. They are a team that are solely dedicated to Provider Connect Australia, and they don't have the long waiting times that you expect to experience. 1 or 2 minutes is probably the absolute max before you'd speak to someone in that team. They actually do a lot of other work with PCA that isn't necessarily related to registrations. And so as far as taking phone calls, they're fully available at all times. We've also got our mailbox. So that's just pca@digitalhealth.gov.au. pca@digitalhealth.gov.au. That's manned by myself and another staff member in our team. And we're specifically there to help people with getting across the line as far as PCA is concerned. So if you've ever got any questions, please feel free to email them through that mailbox and we'd be happy to assist. So I might pause there before I get into an actual demonstration of the PCA system and just ask if there's any questions. No, that's okay. I will very quickly share my screen. I just need to log into the test environment, so I won't be one moment.
I'm sure if Melanie's got her hand up, that was all. If you do, Melanie, just come off mute or pop your question in the chat pane. Otherwise, we'll keep going. No. Okay.
That's okay. I'll just quickly share my screen again. Okay, can you see that, Vanessa? Excellent. Okay, so hopefully, I can't see no questions at this stage. Excellent, thanks, Melanie. I hope, Melanie, that you're familiar with Proda. Most people are by now, given that it has been the way to log into a number of government services on the professional side for the last few years. Interestingly enough, I used to actually work for Proda for several years. So Proda is my real bread and butter and is the thing that I wouldn't say I'm most passionate about, but it is something that I know a lot about. So if there's ever any Proda questions, that is probably something I can assist with. So I'll very quickly log into Proda. Excellent, Melanie. That's great to hear. So I'm just logging in now. I'll just get my verification code. Okay, so once you're in Proda, you'll see a lot of available services down the bottom. If you scroll all the way to the bottom, there's a lovely blue window here called Provider Connect Australia. Click on that one. And it's going to bring you to a portal. In the portal itself, it should show like this when you access it for the very first time. From here, your easily able to register your organization. So up on the right-hand side here, you'll see there's an option for register and setup guidance. Now that's got some really handy guides around some stuff you may need to have ready, some things you may need to think about as an organization before you do register. But you've also got the option here to go to your organizations, at which point you can add an organization. So I'll very quickly add myself an organization just to show how quick it is to register. So select add organization. Just here, so it's got an option to pull your data straight from Proda. So it's got my phone number, it's got my email address. I can untick that and I can enter my details if I like, but it easily pulls that across. It then asks you for your ABN, which I will very quickly grab one. So I would enter in my ABN and it looks that ABN up. It pulls the public data from the ABR. So there's no security concerns here. It literally looks up what is publicly available to people. From here, you can then enter the organization's contact details. So I'll just enter contact number and an email. Same as above. You can also enter in your organization's website. So health.gov.au. We'll then ask for your address. Select add organization. And now I've done the easiest part of registering for PCA. Beyond that, I need to provide some documentation that actually proves that I'm able to act on behalf of this organization. So from here, I'm going to be given a couple of options. I can sign the participation agreement, or I can have someone else sign the participation agreement. If I'm signing the participation agreement, I would need to be one of these three roles. So the director, the secretary, or the delegated authority. We'll get into delegated authority at the moment, but the director and the secretary are obviously the easiest people to get one of these registrations through because it just requires less evidence that you're able to act on behalf of. And that's because it checks the non-public data of the ABR to confirm that you are someone that's able to act on behalf of this organization. So in this instance, I'll say that I'm signing the participation agreement. For a delegated authority, you will receive a statutory declaration that essentially forces you to do these things. So I'll select delegated authority. I'll give my job title as manager.
A lot of practice managers use this option, don't they?
Yes, this would be the most common the most common use case, and this is one of the thing that I especially find is that Proda, for example, it's often the practice managers and then the doctors that work there that have the Proda accounts. I'm finding that owners of the business, so the people who may be the director, don't yet have a Proda account, and so there's that little disconnect there where it's an additional person that needs the Proda account, and that's why this option exists essentially, so that another person's able to do it without forcing the director to register for a Proda account. So I'll save that. It's then going to tell me what it is that I need to sign. So we've got our participation agreement and our statutory declaration. Now, the participation agreement has two options. I can electronically sign it, which I will do. Copy that password. Pop that in. And it will bring up the agreement for me to sign. I'll sign there and save it.
Jay, Melanie is a sole practitioner, so she would tick the director box.
Yeah. So Melanie, are you as a sole practitioner? Are you a sole trader as well, or do you have an ABN as a sole trader?
Yeah.
Yeah, excellent. Yeah, yep. So you would tick if we go back, yes, you would click that you're the director, and it should read with your ABN. As a sole trader, it should be your name on the ABN. I'm fairly sure. I'm hoping I've got your company structure correct. But in that case, it should actually flow through incredibly easy. So from there, yes, you would select director. For the statutory declaration, you would download to sign. Now, Melanie, in your case, you shouldn't need to do this, but if you do, it should have pre-filled this information for you, so you can see it's already got my details here. Statutory declarations are fairly, I suppose, something that we're fairly used to nowadays, in the sense that there's a lot of people that can now witness a statutory declaration. You're not limited by the GP, limited by a JP, but it's got all the professions on the back here if you did need to. I'll save that on my desktop.
Just for the recording and whatnot, a lot of practices have used their registered nurse. They're easy to get to
as someone to witness. Yeah.
If they can't get their GP.
Yeah. Excellent. Yeah. I'll upload my statutory declaration, and then I'll submit it for assessment. I've registered for PCA essentially. From here, what it does is it will flow through to the team that processes these. Now, I don't want to promise how quickly they are, but they're usually turned around within 24 hours at the absolute maximum. I've seen them get processed in 10 minutes. There's no gigantic backlog of applications. And the people that work through these, that's their dedicated role to assess PCA applications. Once that has happened, it will then appear in your organization, in your organizations as an active organization. Now, I'll pause there very quickly. Melanie, was there any questions you had specifically about that? Otherwise, I might quickly demo actually using PCA. No questions? Excellent. Okay, so I will, when I change screens, can you see it, Melanie? Like, can you see that? Cool. So I'll just have to log into a different test environment. Okay, so we can see an organization here. It looks like there's a fair bit going on here, and there is, because this is an organization that's used for testing, and they deliberately overload it with features and things going on, essentially. So please don't let that intimidate you. I will minimize all of this. And we'll see here that we've had the Hornsby Central Medical Centre register for PCA. From here, they're able to add a location. And so this is where they start to put in their actual business details about the genuine practice. So we can put in Ridge Medical Center. Select what kind of location type. So we'll go physical. This is where you can type in the type of features. So if it's got a baby change facility, it's got accessible parking, public telephone, all things like that. And I'll show you why this is important very soon. Enter in your business detail contact number. Oops. Email address. Don't need a fax. I will put my website. Same as my street address. So I'll add that location. Now that I've got my location, this is where I can really set it up so that it flows that information out to my business partners. So can add the healthcare services that we perform. So we do dermatology. Is that not working? Excellent. Sorry, my mouse keeps getting stuck. What have I missed? What have I missed? Oh. Oh, fine. Okay, there we go. No fee. Oh my goodness. The joys of a test environment is that sometimes things don't go as smoothly as you expect, especially when you're trying to show someone something in a test environment. So you can see there, it didn't seem as simple as it really is, but you can also see that the system tries to stop you from progressing without providing all of the information that you need. The fact that I kind of ran through it so quickly, I do apologize, but it was largely to demonstrate me publishing information. From there, you can add things like practitioners. So you can add the practitioners that work there. You can add additional users to PCA. So if you've got, yes, you've had one person set it up, but the reality is that you don't want just a single person using it. You want different people within the team or within the practice using it. You can assign other users. So with that, you simply just need their PROTA RA number. And we've also got our audit events. So you can essentially see a snapshot of anything that's happened using PCA. The big one though that I want to show is once I've entered in all of my relevant business information, I would select publish to partner services. When I do that, it's going to let me select the partner services that I want it to go to. These are all just test ones. So I'll just select this. I'll go to publish and I'll publish that now. Now that information has flown through to my business partner and I can be comfortable that it has. If we go to the NHSD, there we go. So we'll go to Health Direct. I'll give my local GP a bit of a plug. So I'd go to general practice and I search Brackenridge. So I click on this listing within Health Direct on the National Health Services Directory. All of this information is able to come from PCA, essentially. So the NHSD has two methods of obtaining information. The GP can submit a practice can submit a form to the NHSD and ask them to update information for them on their directory, or they can receive it automatically through PCA. So you can see the location details, their opening times, about their service, other services at this location. This is all information that can be updated via PCA and sent through to them automatically. And as I said, this will flow through in a matter of hours, far faster than filling in a form through their website, for example, that they would need to action. This information would flow through automatically. Now, you can still see that one, can't you? Yes, excellent. Now, on our website, we've got a list of participating business partners currently. So if you were to access our website, that's digitalhealth.gov.au/PCA. If you scroll to the bottom, we've got our list of participating business partners. Now, we currently have 37 business partners on board. Got several directory services. So Health Direct, Health Hunter is a new business partner that we've recently had come on board, and they focus on preventative health and connecting you with health practitioners that can help you get on top of ongoing conditions or conditions that may need to be managed in the future. We've also got Precedence Healthcare. We've got all of our PHNs, so our primary health networks. We're starting to get on board some peak bodies and peak associations. So APOTA, the Australian Podiatry Association, came on board earlier in the year. And we've just had the AARPN, so the Australasian Association Register of Practicing Nutritionists. We're heavily engaging across the peaks at the moment in an effort to try and get the peak bodies on board as a way for them to maintain member details. That's something that they've found really, really useful in our workshops with them. We've also got our public health services, so eHealth New South Wales, and a couple of secure messaging providers, so Telstra Health, Foxo, and Recare Australia. As an organisation, we recognise that Provider Connect Australia very much as that chicken and egg type scenario. In discussions with potential business partners, we hear a lot from them that they'd like to see more and more healthcare organisations on board, and lots of healthcare organisations say we want to see more business partners on board. So it's a two-pronged effort from the agency at the moment where we're engaging with both providers but also business partners. In the next 6 or so months, I think that we will see this real avalanche of business partners come on board. We have a lot that are right on the cusp, and there are legal things that business partners need to work through from their perspective and understanding how they'll consume that data once it becomes available to them. So there's a lot that are on the cusp, and unfortunately, I can't specifically mention them until we kind of get them across the line. But it's definitely a heavy focus from the agency currently. I think that's about it. And with just Melanie, hopefully Melanie, I've covered everything. But if you've got any questions, as I said, more than happy to answer them. And if this has been recorded and placed up on the website, then more than happy for people to email pca@digitalhealth.gov.au with any questions that they may have.
Thank you, Jay. That was extremely informative and relevant. So do you have any questions, Melanie? If not, at the completion of this, there is a very short survey. If you could please fill it out, that would be great. Thank you for attending today's webinar, and we will post the recordings and the slides on the website for further reference for the staff to watch.
Thank you so much. Melanie, if you are interested in registering, if you were to call our contact number, so the 02 6223 0741, I would recommend that you ask for Peter. He's the most experienced PCA staff member, and he often does PCA webinars, incredibly knowledgeable, and he would be more than happy to step you through the actual registration process.
Thanks, Jay.
No
Thanks
problem.
for attending.
Thank you. Take care.
Bye.
Bye-bye.